doubles our call volume. On average day in the New York City 911 system, you will see around 3,000 to 4,300 assignments or calls a day throughout all of the 5 boroughs. Okay. The busiest day of the year usually is New Year's Eve. Well, we'll see about 5,000 assignments. Since about last Tuesday, we have been breaking our records. We've done more calls last Tuesday than we did on 9/11.
Wow.
So we did about 6,200 calls, and now we're about 7,000 calls a day, which is almost double our call volume.
Wow.
To put it into perspective, in the last 3 or 4 days, we've done about 48,000 calls in the last week, almost 50,000 calls. That's about almost half to a little bit less than half of what Boston EMS does in a year. So let me put it to you this way. I have been around for the swine flu pandemic. I was working in New York City during the Ebola outbreak. I have never seen some of the things I'm seeing in the ERs. The amount of patients, the amount of critically ill patients coming in waves after waves after waves. What I'm seeing in the ERs are just some of the busiest hospitals in the country inundated with the critically ill. There's also some folks that are just, they have the coronavirus and they're mildly ill. But I mean, one of the hospitals I go to, it's like the 6th busiest hospital in the United States. Their trauma room is inundated with 9 to 12 people, all on ventilators, all sedated, all intubated, receiving, basically ICU care in the ER because there's just no room for them upstairs. Other hospitals and agencies are trying to, spread out these patients and transfer them to other lesser packed hospitals to make room. And it's I've never seen anything like it. Pretty terrifying, to be fair, because to see the age spectrum is huge. You have your elderly patients that we're really concerned about, but then you have 38-year-olds, 45-year-olds, people from all age groups, from all backgrounds, from all races, ethnicities that you can think of, all of them pretty critically ill. And then you have people waiting to come into the ER that are, they think they have COVID and waiting to be seen. And it's just, it's never ending. It's an onslaught, wave after wave. And it's a miracle that we're holding out this well.
Is there such a thing as a lesser packed hospital right now?
In New York City? No. Honestly, it goes by waves. A lot of the hospitals are doing their best to transfer out their critically ill to satellite facilities or other hospitals in the area. So you'll have a wave of the ER clearing out for a little bit, and then it fills right back up. This is pretty par for the course when it comes to flu season, what have you, but I've never seen this many people. We lucked out this week. We had FEMA activated their tier 1 response. They sent a bunch of partner ambulances to help out with the call volume patient flow, and they've been a godsend. I can't stress enough how grateful every paramedic, EMT, police officer, doctor, nurse, PA, anyone that's currently on the front lines of this is to anyone that hopped on an ambulance from Colorado to help us out, because it is unimaginable the amount of people that are ill.
What was the moment? What was it? Was it something you saw or whatever, that the moment you were like, okay, this is getting real?
About 2 to 3 weeks ago, right before we started getting real COVID cases, maybe a week after the first case in New York was announced, we noticed at the busiest hospital you usually go to, we walked in and none of our, for lack of a better term, frequent flyers, our regular patients that, have mental illness, other comorbidities that land them in the ER that we constantly pick up. We walked into the ER and it was a ghost town. It's almost as if the physicians there said, listen, guys, we feel for you. patients, we feel for you, but you guys got to go. We're going to need these beds. And it was empty, and there was ventilator equipment, there was isolation equipment. Parts of the hospital were sealed off to take in the first influx. They built a tent to start screening patients, and I realized, oh, this is pretty serious. And then we fast forward to 2 weeks last week, and I walk into the ER, and it's an hour and a half for me to triage. In other words, to go find a nurse, give report on my patient, transfer them to a bed, and then leave and get ready for the next assignment. It took me an hour and a half to do that. Normally, about 25 to 30 minutes, 40 minutes on a busy day. Hour and a half usually happens when there is some type of catastrophe in the hospital. Let's say, there's a fire, or something wrong with the oxygen delivery system, something to that effect. To see this on a Thursday night, regular old Thursday, was mind-blowing.
The scariest thing you've seen?
Basically, I'd have to say, honestly, patients that for the most part are presenting with vital signs that I don't know how you're conscious. Their oxygen saturation, normal oxygen saturation of a everyday or healthy person is between 94% to 100%. That's a measurement of the concentration of oxygen in your bloodstream at that time. These are folks with no serious past medical histories, just, flu symptoms, having oxygen saturations in the 70s, in the 60s%. And they're barely conscious, using every aspect of their physical being to get a breath in and breathe and just get air to their cells. And it's horrifying. I've seen advanced respiratory illness before. I've seen people in cardiac arrest, and I've never seen people I was feverish 2 days ago, and now I am barely getting air in my lungs.
What good have you seen come out of this?
There are people that are, recovering. I know it's not a number that people see on the news all the time. It's the reason why, again, is because we need people to know the facts, and that you should be scared. This is not, business as usual. But one of the good people are recovering. People, some people aren't getting as sick. Some people get it, stay home for a week or two, and go back to work and are fine. One of the things I'm definitely seeing that is a good thing is the amount of camaraderie and my friend put it this way: Americans being Americans. We're all pitching in, doing the best that we can. Like I told you, we have EMTs and paramedics from Colorado. They drove here. There's no plane that you can fit an ambulance in. This isn't the military where they can just airdrop you. These folks drove from Colorado in their ambulances to help. We have restaurants that, they're not doing great financially currently, as they can't, be open, donating mountains of food to ER staff. There's some departments are finding lodging for their employees because they don't want to go home and between shifts to possibly infect their partners or their families. It kind of reminds me of 9/11. People just coming together, doing the best they can with the situation at hand to help out one another. It's kind of amazing to see how nicer New Yorkers are lately, thanks to the current situation. But yeah, that's one of the positives.
What would you want to tell people if they're not taking it seriously? No, we don't want to dramatize it. Not everyone is going to get dramatically sick and pass away. Like, that's not necessarily going to be the case. But what would you say as someone who's like living in kind of the worst of it right now? Like what they need?
The best way that I could put this in a manner that, bluntly, is New York has lost more people to coronavirus than passed away during the September 11th attacks. Okay. You can't go to a corner in this country without speaking to somebody who knew someone that passed away on 9/11, especially if you're from New York. We're having that happen now. This caused the shutdown of multiple countries, of a city of 11 million people. This isn't business as usual. Okay. New York City is the economic powerhouse of the country. It's where one of the largest stock exchanges in the country exists. All of this is shut down. Times Square is empty. There isn't a soul walking the streets of New York City right now. Yes, you'll see some videos of people not following social distancing, but it's I've never seen the city this empty. I can't stress enough the amount of people I've seen critically ill. The thing I can tell you right now is that take this seriously. You may not get sick. You may get a little sick, and hopefully that happens to you. Hopefully that's the worst it is to you. But there is somebody you know in your family, someone that you care about, that this disease can absolutely kill. Without a doubt. It would be in your best interest, if any of these people matter to you, that you take the guidelines recommended by your local government seriously. Stay home if you can. Wash your hands. Do everything you can to avoid being in large crowds. And just take it seriously. This is no joke. Friends of mine are currently in the ICU, intubated and on a vent. This is, and they're not old. They're not in their 60s. This 34, 35, 36 years old. They're young. Please, I can't stress this enough. Take this seriously. Don't just stay home. Please stay home. You are putting people at risk. The first responders in community, the cops, the firemen, EMS workers, at risk every time that you go out and possibly help spread this disease, making them have to go respond and take care of the people that are critically ill. But more importantly, just don't end up like us, because this is not enjoyable, at the say the least. This is terrifying, to put it lightly.